Right. So as far as the business analysis from the Facets point of view, there are some questions you have given.
Right.
So let me answer you one by one.
Okay.
The first one is about, let us understand what exactly Facets from a high level point of view. Then I will
Right.
get into the next point, because as we have already discussed this couple of times, but still let me repeat it.
Okay.
Facets is a kind of application which is majorly used in the healthcare environment, where to manage the claim processing and all that stuff. Means usually when we are discussing about the healthcare system, first of all, we need to understand who are the players in healthcare system. Players, right? Players.
Right. Right.
Players. The first one is called provider. Provider is a player.
Right.
Provider means person who is providing health care to the patient is called payer, right? The provider, right? So this is point number one. Second, patient. That is point number two, because people whoever is taking services and all everything is comes under that category. Next, payer. Payer nothing but a person who is paying against to the claim processing, whatever submitted to them. This is what generally we call it as payer stands for. Payer. Payer can be anything. Payer can be an insurance company. Payer can be CMS like Medicare or Medicaid services of that sort.
Right. Right.
Because if you take any individual as a person with his family or as an individual, everybody will have their own insurance. Either this insurance, they may get this insurance plan as they are working for an organization, because if a person is working for an organization for XYZ, apart from the benefits, whatever they are providing, they have to provide a healthcare benefit to their employees. This is all part of the welfare, because employer has to take care of the welfare of an employee. On that grounds, healthcare support will be provided. So for that, they will provide some health insurance plans to these people. Okay, this is one thing.
Okay.
Second, an individual can take an exclusive private insurance plan of their choice. This is point number two, right? These are the two options. Some people have both. That is their interest. Okay, this is
Right.
the thing.
Right.
Now, if an organization wants to take an insurance, insure their employees, what usually these people do? These people will have an association with an insurance company. If it is private insurance, I'm talking about insurance company.
Right.
Wherein they will come up with some customized plans. Customized. Because if you remember, when I explained about Medicare, Part C is a Medicare Advantage plan. Right? So because Medicare and Medicaid are the two major things. Medicare is taken over and managed by the federal government, whereas Medicaid will be taken care of by the state governments.
Right.
Right. So when Medicare, in this Medicare, we have plan A, B, C, D, and so on. In this plan C is a kind of Medicare Advantage plan. This can be issued by a private insurance companies, right? So this is private insurance companies can be issued. Depends on the kind of customization what they make with the organizations. Apart from the one services, whatever is provided, any customizations and all everything is subject to the understanding between the organization to an insurance company in other insurance plans.
Right.
But whereas if it is standard plan, the same plan will be given, but the kind of benefits what an individual is getting in the organization, sometimes it varies, depends on the kind of band they belongs to, depends on the designation they have. Based upon the designation, what is the eligibility for them may vary sometimes, depends on the policies to policies that will be varied. So if you see that people who are involved in the healthcare organizations, healthcare segment, one is provider, payer, patient. right? So subscriber, etc. Right? So these are the things. Now, what healthcare organizations do, right, providers do? Providers will provide a treatment for a person, for a particular person. Against to that, whatever the treatment they have given, against to that, whatever the billing happens, or whatever the cost happens. This cost may including procedure. This cost may be including for diagnosis. This cost may be including of the treatment, whatever it is, right? It could be of anything. So for whatever the treatment they have given, right from the person who has joined till person has discharged, whatever the cost, including medicines cost, etc., right? Everything, right? So that we already know it. So every cost will be updated in a document. This document will be shared to the insurance companies. Insurance CMS or private insurance companies, this will be sent to the payer, so the payer will pay accordingly. This is the context. Normally, when there is a form which normally we used to send, earlier we used to have paper claims.
Right.
After that, when there is an EDI transaction came into picture, electronic data interchanges and all, everything is on encrypted format. Every procedure and all, everything will be based on some code number. So those code numbers has to be updated on the records and it has to send. But to manage all this, what is required? Because this is not something we are sending through email, right?
Right.
In the beginning days, I'm talking about way back, long back time, they used to send through email system or so. There is a possibility that health information can go outside, which should not be the case. In regard to that, there are some HIPAA rules and regulations which government has initiated. What this HIPAA rule says that it's a kind of regulatory board, I can say, controlling regulatory board. What this regulatory board do? Regulatory board will make sure whoever is involving in this particular process of the healthcare system should not violate the rules. Okay, should not violate the rules. What are the rules? Organization HIPAA rules will give you the guidelines. The kind of systems they use, the kind of procedure they follow, the kind of administrative activities, the kind of information they want to send. Everything should be based upon the HIPAA rules and regulations. Either it could be a provider or it could be a payer. Both has to, provider means healthcare organizations, hospitals, clinics, nursing people, all that. At the same time, payer nothing but insurance companies. Everybody has to follow the rules and regulations of HIPAA. So HIPAA is a regulatory body, in a simple to understand, regulatory body.
Right.
The same regulatory body you can see in finance, you can see in insurance also.
Okay.
From a context of India, I can say, in India, usually in insurance, there is a board called IRDA. From the context of India, I'm saying, right? So, because like this, there are other regulatory boards are there. It is not something material required for us, but they're simple note, IRDA.
Right.
Insurance Regulatory Directory of Authority of India, right? So IRDA. So this authority is a regulatory board which authorize whoever is managing the insurances and all, whoever is doing insurances for people in that respective country in India, they have to follow the rules and regulations of the government, which was initiated, right? So they have to give utmost welfare and utmost care towards the person who is getting insured, right? That's what insurance company's responsibility. They should not give any false promises, right? No false commitments, nothing. Right, so this is what IRDA stands for. So IRDA always will have an eye on all the insurance companies. We'll see whether they are following the right rules and regulations or not, is what usually these people see. This is what generally we call it as IRDA do. So the same way, more or less, I'm not comparing 100%, more or less, HIPAA is also something like that. So Health Insurance Portability and Accountability Act, which majorly protecting the health information of the US healthcare information, right? So this is the context. Now, coming back to the first question, this was the introduction, which was clear already. Right. The first question, right? So whatever the information I have explained you so far about the overall picture about the healthcare system.
Right.
Now, coming back to the first point. First point, Facets is a subscribed system that can be customized to the providers or payment required, correct or not? Yes. Point to be noted here is Facets is a kind of application which will be standard because Facets is powered by Trezito. Trezito is parent company, I can say. Trezito Facets, we call it as.
Okay.
Through this Trezito Facets, what usually happens is it's a claim system, claim software, I can say. This claim software, whatever the modules and all everything, there are different modules. If you want, you can write down the modules, please. You can write down,
Okay.
please. Right.
Yes.
There are different modules will be there in Facets or else groups, whatever it is. The first is billing module you have. Right.
Okay. Yes.
You can make a note of it. It is better for you to understand better, right? So billing modules, provider module.
Yes. Okay.
Claims module, claim processing, adjudication, everything comes under that category.
Okay.
At the same time, membership module. Okay.
Okay.
These are the main modules. Whatever I am saying you, these are the more main modules. Like billing means whatever the healthcare expenses and all, everything has to be billed, right? So for that billing, provider, provide nothing but healthcare organizations, claim processing, how the claim processing and adjudication should happen, and what steps to be taken care of. At the same time, membership. Whoever wants to take membership means insurance I'm talking about. So that is one more. So these are the major modules which are there in Facets.
I'm sorry, can I just interrupt you for 1 second?
Please.
When you say membership, you mean membership as in whichever insurance company who wants Facets?
Yes, not that. A person who is who will be a member here, right? So that is it. That is what it is.
Member of the insurance company.
Member of insurance. That's what it is. Membership stands
Thank
for.
you.
Okay. So these are the 4 major modules, I can say. But apart from that, there are other groups like risk application groups, at the same time, customer services, at the same time, medical plans, network, because network means wherever the hospital, wherever the patient, wherever the doctor is available, right? East and as well as west kind of, right? So network, different networks and all that information. At the same time, profile applications, subscribers, workflows, benefit configurations. So these are the different groups which are available in Facets. So it's a complete application. Yeah, go ahead.
Sorry, I'm sorry. So
Please.
members of insurance companies also have access to a module of Facets?
Can you repeat again? Member of insurance companies means?
When you say membership
Patients,
module, right? So
we're talking about patient?
Yes, yes.
No, patients will not have will not have an access.
So I'm sorry, but can you explain the membership part again, please? I thought it was
membership. Yeah, membership means, see, first of all, you have to understand Facets is an application used by 2 people. One is by the provider and second is by the payer.
Right.
Provider sending document or request to the payer. Payer is paying against to the cost of the expenses. So who uses here? These Facets application will be used by majorly by the providers, insurance companies, as well as
CMS.
Healthcare organizations. Right or not? Right. So healthcare organizations will use it. Whatever are we talking about? Are we talking about this thing and all everything? So this is what generate. These are the 2 people who uses this, right? So this generally this is what generators. Now, when we talk about member means person who is having a health insurance plan is called a member.
Right.
Understood?
Yes.
Understood or not? Right?
Yes, I did.
So whoever is having a health plan, this usually when we talk about this membership, this person may be an healthcare provider also. For example, doctor, right? Maybe, right? Either maybe a nursing staff. So these people have to take a membership here. Understood?
Okay.
Understood or not?
Yes.
No,
so
right?
it
So
can
member is a word we have to use for 2 different people. Person who is having an insurance plan, point number 1. right? Point number 2, this can be even a doctor, healthcare provider also, right? So those people will also be comes under the members here, right?
Okay.
Understood or not?
Yes. Yes.
Right. So member means person, whoever is having a plan is called as a member. Whoever it is, right? So it can be in doctor, it can be in nursing, right? So they also have in health insurance, they'll also uses it, right? If it is required to them. Understood, right? So this is the point. So coming back to the point, facets, these are the different modules and as well as groups are there in facets. So this is a complete application which can be used by the providers and as well as by the payers. Okay. Yes. Customization subject to the correction, subject to the requirement, subject to the acceptance, customization will be taken place because whatever are required, because as I told you, majorly if you see Facets as an application, we have 4 different things, right? 4 things will be there, right? So for example, member is one thing, which I have told you. Member is the one thing. At the same time, claims. At the same time, billing, provider. These are the major ones. So everything will be covered. So organization doesn't require any kind of configurations to be made. Nothing, I mean, in not configuration, customization required, not required. Honestly speaking, there is no customization required. Unless if there is any kind of customization it is required, subject to the acceptance of the organization who is providing the application, will do the necessary changes. Okay, this is point number 1. Point number 2, you need to understand this from another point of view. What was that? For example, there was an application called, I'll tell you, QNext. For example, there is another application called QNext. QNext is also a claim processing application. Let's say, for example, someone is using QNext. Someone is using QNext application for a long time. Now they want to transform their this processing systems, claims and all everything towards Facets environment. This is what usually we call it as data migration. You are configuring, you are configuring the Facets. You are transforming the whole application from QNext to Facets. These sort of things will also be taken place.
Okay.
For example, hospital, there is a healthcare provider called X is a hospital or a Y is a hospital. That hospital is using a QNext application for a very long time.
Okay.
Now they want to transform their systems and their processes towards Facets.
Right.
Right. So that configuration and all everything is what generally being a business analyst you may be required to involve.
Okay.
Do you understand this? Right?
Yes.
Subject to if that situation arises, I'm talking about, right? Because sometimes complete application transformation might be taken place. But in this process and all, data migration is also required because we have to migrate the data, right? We have to migrate the complete data. So the data migrations and all everything will be taken care of here. So this is where the reason why when we talk about customized means it is not completely customized, configuration. Facets configuration is what being a business analyst we have to do upon the request, whichever is received. On what basis this will be received? This is based upon the technical requirements which our team has specified. Because, for example, if there is a scope of technical scope is required and all, based upon that, whatever the necessary configuration changes and all everything to be made, that changes has to be identified by the business analyst. This is where being a BA, you will be involving. Understand? Clear? Right? Next. In addition to that, you should be able in a position to understand the existing system also.
Right.
If you remember, I think whenever you have gone through your BA training, you might be learned about as is and to be.
As is and to be, yes, exactly.
As is nothing but existing system, to be nothing but the one you are developing. So transforming from as is and to be is called, we call it as gap analysis, right? So for that gap analysis, we do in BA. Okay, forget about it, right? So first of all, you need to understand the as is system. Next, you are transforming to be, right?
To be.
Right?
Yes.
So assessing the impact of the existing system followed by those configurations has to be understood by you. This is also
Okay.
one more responsibility being a BA you have to do.
Okay.
Understood? Clear?
Yes.
Shalini, right? This
Yes.
is, I think, first question you got
Yes.
an answer.
Yes.
Second question. Does provider EHR and ERP systems like whatever it is have billing
Yes.
module that comes integrated with Facets? Billing is a module which is a part of Facets, subject to correction. Right? Point to be noted.
Right.
ERP is a system which is used to um, enhance the business process of the organization, because a lot of departments are involved. To integrate a lot of departments, ERP systems will be used. Something
Right.
like Oracle ERP, mostly widely used healthcare application like Oracle ERP, different ERP applications we have, of course.
Right.
Even SAP also, to that
SAP,
matter,
yes.
SAP ERP, right? At the
Yes.
same time, Joho ERP is also there. So different ERP systems can be used by the organization. That is different. Okay. But when you talk about billing modules and all, everything comes under Facets, not comes under the ERP. Do you understand this? Right?
Yes.
Facets as an application, billing is a module in it.
Okay.
Clear to you, Shalini?
Yes.
Next,
Yes.
third question. Does the payer have their own ERP systems in Facets integrated? Just now I have told you. ERP,
Yes.
they use different ERP systems, right? So that ERP systems can be integrated with Facets. That is what generally these configurations and all everything will be done by the integration team. Technical integration team has to do that. Because if you want to understand the technical integration, first of all, you need to understand the existing system, what technical configuration it has, right? So is it can be easily convertible, or do we require to develop right from the scratch? So all these things are required. So I think third question you got an answer for that, right?
Yes.
Because second and third almost are the similar questions.
Same. Yes.
Okay. Next, fourth question. What happens after the payer receives the claim? So once a payer has received the claim adjudication will be taken place.
Okay.
And whatever the payer cost was mentioned, for example, for some particular procedure, there is some cost was mentioned. Okay. For example, some $20 was mentioned. Let's say, as an example, some $20. That is what generally the cost was proposed. But healthcare provider has mentioned it was somewhere around 30. Claim adjudication will be taken place. Why it is 30? What is that it was involved in it? Because it was supposed to be that 20. Right? Why is this 30?
Right.
So the proper clarification has to be given by the provider. Based on that, claim payments will be done subsequently. Right? So what payer do once they receive claims means, once they receive claims, what usually they do is they do the claim adjudication. Based on that, whatever necessary to be paid, that will be paid back. That's what generally they do. Okay. Next, fifth question. How are the claims paid? Is there any other system to make the payments to the providers? There is no specific system as separate, which will be incorporated in this itself. Because there are some ACH will be there. This is where we need to understand about ACH, because you have asked me something about ACH also somewhere. 1 minute.
That was the claim scrubber.
Yeah. This question you have asked me, right? So I am connecting this question with this. Okay.
Okay. Okay.
These two. Let me answer this 5 and 10 in combined.
Okay.
Okay. In combined. Normally, what happens whenever a claim has submitted, especially for the organizations and all that, whenever the claim submission has submitted and all that, usually clearing house means where the payments will happen. That is what generally we call it as a clearing house. For example, we are working for an organization, right? We are working for an organization. Every month 31st or 1st of every month or 31st of that particular day, we get our salary auto-credited. Auto-credit happens, right or not?
Okay, right.
So how it happens, this is what generally the concept of clearinghouse transfer. Okay. Understood, right?
Yes.
You can write down what is clearinghouse transfer. You can write down. Clearinghouse is the one which transmits
I'm sorry, I think it got interrupted. Clearinghouse is the?
is the one.
Okay.
Clearinghouse is the one
Uh-huh.
which transmits electronic claims to
Okay.
insurance carriers. Understood? Right.
Right.
Right. So clearinghouse nothing but payments, relating to the payments, whatever the payments to be done, everything happens under clearinghouses. So
Okay. So I
automatically
think
that based, tell
I
me please.
sorry, I think my confusion was so this is just one clearinghouse where all the insurance companies and CMS payments get transmits?
Yes, they
Or
follow a clearinghouse, a standard clearinghouse they follow.
okay, so
They
all insurance
follow,
companies are linked to this.
has to follow the clearinghouses, but the channels will be different. The
Okay,
channels are
for
different.
each company meaning.
Channels are different.
Okay.
Channels might be different, but end of
Okay.
the day, everybody has to send their payments to the payers and all everything through the clearinghouses only.
Okay.
Right. So through the clearinghouse only, they have to pay that. Payments and all everything will be paid through the clearinghouse itself.
Okay.
Understood? Clear? Right.
Yes.
Next, second point is about claim scrubber. You have asked
Scrubber.
me,
Yes.
right? Claim
Yes.
scrubber. Claim scrubber means whenever we are sending the claims, the information where it has to be mentioned, right? For example, you can write, I'll tell you. Claim
Yes.
scrubber is a process. It is better to remember if you write it, right? Claim
Okay.
scrubber
Yes.
is the one which is the claim scrubber is the process which verifies whether all the CPT codes which are relating to medical claim are accurate or not. Understood? Right?
Yes.
Understood?
Yes.
Because whatever the codes and all everything we use, they have to see, right? So whether they have to verify and validate whether these codes were right or not. So for that, generally claim scrubber. So whenever there is a claim document we send, usually that will be going to the claim scrubber first, right? So it will cross-check. It will cross-check whether whatever the CPT codes we have used and all verified and all is accurate or not. So after that, the process and all everything will be taken place. Against to that, if there is any corrections or any clarification required, claim adjudication will be done by the payer to the provider, right? So based on that, finally through ACH clearinghouses, payment will be made to the providers.
Provider. So basically, it's these steps, right? So claim gets submitted. It goes to the claim scrubber. Then it goes to claim adjudication. Then
Claim adjudication comes next. Claim scrubber. From claim scrub through claim scrubber, it will be received to the provider. It will be received to the payer, right? So if there is any clarification, payer will give a claim adjudication. We'll do the claim adjudication. For example, these are the corrections I require, right? So these are the clarifications I want. This is what generally claim adjudication means. Claim adjudication is nothing but claim query. Claim adjudication means whatever if, for example, if I want anything to be clarified before I'm accepting or rejecting the claims, whatever the process I follow, wo hum bolte claim adjudication.
So that comes after the scrubber, right? Adjudication comes after. Yes. Okay.
Processing next. See, claim process is the first step. Adjudication is the next step, usually.
Okay.
See, I have sent an email, right? I have sent the documents, right? I have sent some documents. You have received it, right? You have some queries, right? Or else you have some questions to be, you want to know some questions. What you did, you have answered, you have sent me an email to me, right?
Right.
Yes or no, right? This is what we call it as claim adjudication, I can say. Too simple to understand it. Right? Whatever these are the things which you required some clarification. So whatever the mail I have received from you is what adjudication stands for.
Okay.
So my responsibility is to answer these points.
Okay.
Understand? Against to what, for example, I have sent some information, against to that reply about the clarification, whatever you want, is what we call it as claim adjudication.
Okay.
Clear to you? No?
Yes. Yes.
Claim scrubber, verify whether the codes and all everything were accurate or not. Clearing houses will payments, where the payments will process and all everything happens through clearing houses.
Okay.
Okay, because anyway, I'll send you FAQs also, frequently asked questions to you. Apart from this,
okay,
I'll send you detailed frequently asked questions relating to facets. You can go through that even, because these are not only, right? So there are a lot many you come across in coming days.
Sure. Yes.
You can see. Okay, that is the okay. Next question. Which system is used to send EOB communication to the providers and patients? Usually it is not the case, because please see, for example, explanation of the benefits and all everything, insurance companies, because provider, right? So provider, because for example, why is a person who has submitted, who has given a request to insurance company, okay, insurance company, that please insure me, right? So whenever they have accepted, they have to provide all the benefits. Okay. There is no separate system we use for that. Okay. You understood my point? EOB. I'm talking about connecting between provider to patient. I'm talking about, right? Right. This is what it was, right? There is nothing of it, sort of, because, for example, a person has, because this is all happens through the email system, what they have sent. Based on the acceptance of the insurance, they will send you the benefits, right? What are all the benefits you will be getting with this insurance and all everything they will be giving. That's what it is. Right. Understood? Okay. Next. Yes. Yeah. Regarding the screenshots and as well as templates and all that, I will see, because I think I have my old these things were there. I will tell you. These two I'll tell you. I will see and tell you. Okay. This is one more. Next, Facets processing codes are assigned on the basis of what? Processing codes based on the that's what, because procedure codes are different. Diagnosis codes are different. Claims related stuff, claim code is different. For example, I want to send a claim. The kind of code number what I use is different. Right. Understood? Right. For procedure, there is a separate code. In this procedure, there are a lot of procedures. No, I procedures think may be 100.
Oh, right. But what I meant was, when you had explained the claim, the facets processing flow, you had given me four codes.
834, 835, 272.
No, not those. Not those. The code number 1 for completed and awaiting batch. Code number 2 posted to batch. Code 11.
Document, I'll forward the document to you. Yeah, that document I'll forward, because there are a lot of codes are involved in it. That I will forward.
Okay.
I'll send you the document, because it's quite, because especially as far as the codes itself is concerned, there are a lot many, which leads to confusion. I'll send you the document along with the FAQ so that you can go through. Okay. So you'll have an idea about that. No problem.
Okay. Thank you.
Okay. This is one thing. Next, 10th question was answered. It was already. Next, are the customer application that interfaces with Facets, which technology database they use to insurance by the insurance companies? See, insurance companies use it, Facets as a claim processing application. Okay. If they want to integrate this application with any of the internal systems which they are using, that their people will take care of that. That you are being a business analyst, you are nowhere related to stuff. Right. Is there any kind of configuration related stuff and all everything you have to configure? Again, I'll tell you where being a BA, where you will be involving in Facets. I will tell you detailed again. Okay. I will tell you. Okay. This is one thing. Next, if Facets is already there for a payer, then what will be the role of a BA job? Yeah, right down. So what being a business analyst you will be doing when you are working on Facets? Please make a note.
Yes.
Please make a note.
Yes, I am writing.
Yeah. The first point, being a business analyst, what is that we do whenever we are working on the Facets, especially in reference to the healthcare, is that Facets configuration upon request of changes. Whatever the Facets configuration related stuff upon requirement of the changes, technical scope related stuff, right? So that is where generally being a BA, you will be involved in.
Right.
Okay, this is point number one. Point number two, understanding the impact of the existing system and its configurations. You need to understand the existing systems, if any.
Right.
Okay, right.
Yes.
Next, third point, you need to assist by developing health plans. Health plans, health plan or health plans. Like you need to evaluate, you need to design, right?
Okay.
So whatever the health plans people are implementing, because organizations are implementing different insurance companies I'm talking about, right? What are the health plans they are going to implement and all that. So based on the business initiatives and all everything. So that implementation part, that health plans designing will be done by the BA. Designing means related requirements will be given by the BA.
Okay.
Okay. So the design part, testing and implementation one will be done by the technical team.
Okay.
Why it is required? Because these plans has to be incorporated in the facets. This is where generally facets configuration come both.
Okay.
See, for example, there is a facets application. Okay. There were 10 plans now. In these 10 plans, there are 2 plans which they want some modifications. Which they want to do some modifications. That modifications has to be done, right? That modifications has to be done. For example, 2 more plans were added. Right?
Right.
Those 2 plans has to be designed by your team. Requirements will be given by the BA. That will be designed by your team, and the necessary configurations and all everything will be done by the team members. This is where facets configuration come into picture. Understood?
Okay. Yes.
Right. For example, I'll put you something. For an application, there are 4 modules. Right? You want to add 2 more modules. What is that you do? You have to check the configurations, right?
Right.
Or else in the existing 4 modules, you want to do some modifications in this 1 or 2 modules, right? Based upon the business rules. That is the same way it is. Okay.
Yes.
Understood?
Yes.
Next, you must have a knowledge over claim processing and adjudication. The one which I have told you, the process I have told you, right? Detailed process and all that.
Right.
Next, you need to know about authorization process for Medicare and Medicaid programs also.
Okay.
You need to have a knowledge over authorization process for Medicare and Medicaid programs also, followed by eligibility, etc.
Okay.
Right?
Yes.
Next, you need to have a knowledge over transaction codes, EDA transaction codes, something like 270, 271, etc. Right? Whichever I have mentioned you earlier.
Yes. Yes. Okay.
Okay, clear?
Yes.
So this is it. Next, after that, as I told you, there are modules, right? Facets modules, subject to the people have knowledge over that facets module. If the people have a knowledge over that facet module and all that, so that knowledge is also required.
Okay.
Okay.
Yes.
Next, possible database team usually do the setting of tables and all. If you want to have, you need to have the knowledge also. Setting up of tables, right? Because tables, if you remember, in last 2 sessions before I have told you, setting up of tables like field names, description, field descriptions, etc. So that knowledge should also be there to you.
Yes.
At the same time, you need to have a knowledge over HIPAA codes, right? EDA transactions, as I told you. At the same time, HL7, which I supposed to explain. Tomorrow I'll explain you HL7.
Okay.
At the same time, the CPT and CMS forms knowledge is also required.
Okay.
Right? So this part I'm going to explain tomorrow, right? HL7.
Okay.
So this is
This
what
recording
generally
is
being
just
a
about
BA.
ending. Yes.
Sorry? Yeah. I'm sorry.
The
Of course.